The fluorescent lights hummed overhead like a swarm of insects trapped in glass. Megan O'Brien pushed through the pediatric ward doors at 6:36 a.m., her badge clipped to the pocket of fresh scrubs, her shoes making that particular squeak on the linoleum that meant the floor had been freshly waxed. The smell hit her first, antiseptic layered over something sweeter, the particular scent of a children's hospital where the walls were painted soft yellow and laminated animals decorated every surface as if brightness could cure anything. She moved through the corridor without greeting anyone. That was the rhythm of her days: arrive, blend, work, leave. Invisible. The nurses' station exploded with morning chaos, residents reviewing charts, attending physicians barking orders, phones ringing on every line. Megan collected her assignment sheet from the mailbox without making eye contact. Pediatric ward, 7 beds, 3 admissions overnight. Standard. The third name on the list made her pause for exactly 1 second. Garrett, Emma. Age 8. Vision loss, etiology unknown. For days admitted, 3 specialist consultations, 0 diagnosis. She moved to the medication cart and began preparing the morning rounds, her hands moving with the automatic precision of someone who had done this exact task 10,000 times before. Her fingers were marked with old scars, small, precise lines that crisscrossed the back of her knuckles like a secret alphabet. The kind of scars that came from broken glass or shrapnel or things people didn't ask about. She kept them hidden under her sleeve as much as possible, and nobody had ever asked their origin. The pediatric ward had 17 beds across 3 rooms. Most held the ordinary casualties of childhood, asthma attacks, broken bones, appendicitis. The kind of suffering that resolved with proper care and time. But the corner bed in room 3 held something different. Emma Garrett sat propped against pillows, her small frame dwarfed by the oversized hospital bed, her eyes open but unfocused. She wasn't looking at anything. Her right hand clutched a worn stuffed animal, some kind of rabbit, grey from repeated washing. Megan reviewed the chart at the nursing station first. 8 days of vision loss. Started with blurred edges, progressed to complete blindness in both eyes by day 3. Ophthalmology had found no retinal damage, no optic nerve abnormality, no cataracts. Neurology found no lesions on the MRI. The specialists had all written the same conclusion: functional vision loss, likely psychosomatic, recommend psychiatric evaluation. The child's father was a 4-star general. He had left detailed notes in the chart requesting every specialist, authorizing every test, and those notes had gradually shifted from hopeful to desperate. Megan read the most recent entry twice. 3 different teams. All stumped. She checked the 4-line first, normal saline at 20 milliliters per hour, dressing intact, no signs of infiltration. The heart monitor showed steady rhythm, 88 beats per minute, normal for a sleeping child. Her hand brushed Emma's forehead as she adjusted the monitors, feeling for fever. Cool. Normal. Good morning, Megan said. Her voice was measured, calm, the kind of voice that didn't startle. I'm Megan. I'm one of your nurses while you're here. Emma's eyes moved toward the sound but didn't focus. I can't see you. I know. Megan pulled the rolling stool closer and sat down to eye level, or what would have been eye level if Emma's eyes were actually tracking. They weren't. They were pointed generally forward but locked on something beyond the room, beyond sight, beyond the hospital walls. Can you tell me what you see right now? Darkness. Gray, Emma said. Like fog that won't move. Megan nodded slowly, making a note. That detail wasn't in the charts. The specialists had documented complete vision loss and stopped there. They had asked the technical questions: light sensitivity, visual field defects, photophobia. They had not asked what the darkness looked like to a child. How long has the fog been there? Since we came back, Emma said. Daddy was supposed to be home for my birthday. He came home early but something was wrong. I could see his face changing and then I couldn't see anything at all. The rabbit was pressed against Emma's chest now, one eye button loose and hanging by a thread. She was 8 years old. She was blind. She was a general's daughter. and she was waiting for someone to notice what the specialists had missed. The door to the room opened hard enough to rattle the hinges. Dr. Marcus Whitfield stood in the doorway, his white coat moving like a sail, his presence somehow making the room feel smaller. He was 48, possibly, with a kind of tan that came from vacations to places with names and the kind of authority that came from a medical school where your family had made donations for 3 generations. His eyes moved past Megan as if she were part of the furniture. "How's our psychosomatic case this morning?" Whitfield said. His voice carried the particular cadence of someone used to speaking and having people listen the first time. "Any breakthroughs overnight?" Megan remained seated. She described her visual loss as grey fog. "That's a new detail." "Vision loss?" Whitfield pulled the chart without looking at her. "There is no vision loss. The child is presenting with a conversion disorder masquerading as ophthalmologic pathology. 3 specialists have confirmed normal anatomy. The diagnosis is psychiatric." "The fog started when her father came home early," Megan said. "Still seated. Still steady. Something was wrong with him." Whitfield looked at her for the first time. His expression was the expression a surgeon makes when a medical student asks a question during an operation. "Your role is to monitor vitals and administer medications. Not to construct psychological theories based on a child's imagination." He turned back to Emma. "Sweetheart, Dr. Levinson will be coming by later." "A psychiatrist?" "Someone who specializes in helping children when their body is playing tricks on their mind." Emma's hand tightened on the rabbit. Whitfield left. The door swung closed behind him with a soft pneumatic hiss, the sound of authority dismissing itself. Megan stayed in the room another 5 minutes, asking quiet questions about the fog, about the day it started, about what her father had looked like. Emma described a man carrying something. A burden. Something that changed how he moved and how his voice sounded. For days in this hospital and nobody had asked those questions. 3 specialists and a team of residents had reviewed the imaging and written formal assessments that concluded a child's blindness was imaginary. Psychosomatic. In her head. The tarnished challenge coin in her scrub pocket felt heavier than it should. It had been a parting gift 18 months ago, given by a special forces unit in Helmand province to a medic who wasn't supposed to exist. Megan had promised that if anything happened to the unit's commanding officer, if anything happened to General Marcus Garrett, she would watch over his family. It was the kind of promise made by soldiers, made knowing the odds, made anyway. She had kept that promise quietly, moving through the world invisible. But invisibility wasn't working anymore. Emma was blind and the hospital was trying to cure her with psychiatry. Something was deeply wrong with that calculus, and Megan could feel it the way she could feel pressure changes before a storm. It was a sensation in the back of her neck. It was certainty without evidence. She knew what the specialists didn't know: sometimes the eye works perfectly. Sometimes the problem is that the brain is protecting itself from seeing something it can't survive seeing. Sometimes blindness wasn't a medical failure. It was the body's mercy. And sometimes one nurse paying attention mattered more than 3 specialists and their certainty. The morning shift continued. Medications at 8:22 a.m. Breakfast trays at 8:30. Vital signs every 4 hours. Megan moved between the beds with the economy of motion that came from muscle memory, from doing this work so well that it became invisible. She checked central lines and 4 dressings, updated intake and output totals, answered call lights from parents worried about their children. By noon, the chart was building a clearer picture. Emma's vitals were perfect: blood pressure 110/62, heart rate steady, oxygen saturation at 98% on room air. Neurologically, her pupils dilated and constricted normally. Her eye tracking was intact. Everything about her physical exam was textbook normal. Except the fog. Except the blindness. Megan had spent 12 years in the Navy, 12 years and 4 months, to be precise, learning to read what people didn't say. She had been trained to notice the details that mattered: a changed breathing pattern, a pause that meant lying, a posture shift that indicated pain someone was hiding. She knew how to piece together incomplete information and find the truth underneath. The truth underneath Emma's case was that everyone had looked but nobody had seen. The fluorescent lights continued their mechanical hum. The day shift began to blur into the evening shift. Megan found herself assigned to Emma's room again at 4:53 p.m., and she stood at the child's bedside reviewing the specialist reports one more time, looking for what 3 teams of doctors had somehow missed. And there it was. Hidden in the neurology note, almost a throwaway observation: patient demonstrates intact pupillary response and eye tracking, inconsistent with acute vision loss from recognized pathology. Inconsistent. The word was medical code for, this doesn't make sense the way you think it does. Megan pulled out the ophthalmology images on the computer terminal. The optic discs were perfect. The retinas were perfect. The visual cortex on MRI was perfect. Normal. Pristine. Completely intact. A child doesn't go blind from a perfect eye. Unless the eye was trying to protect the brain. Unless something had happened that was so terrible the only survival mechanism left was to shut down sight itself. Unless Emma had watched something she couldn't unsee and the only solution her 8-year-old mind had found was to stop seeing it altogether. Megan closed the chart and walked back to Emma's bedside. The girl was sleeping now, her small frame curled around the rabbit, her breath steady and even. "We're going to figure this out," Megan said quietly. "I promise." Dr. Whitfield held Emma's chart up to the fluorescent light of the grand rounds room like evidence at a crime scene. 15 residents sat in tiered seating, their white coats pristine, their attention locked on him as he began his presentation. Megan stood at the back of the room in her scrubs, near the supply cart, restocking 4 kits with mechanical precision. She didn't look up. 8-year-old female, Whitfield announced, his voice carrying the smooth confidence of a man who had never been contradicted in his own domain. Presenting with sudden vision loss. 3 separate specialists have cleared her for neurological, ophthalmological, and structural pathology. All imaging is normal. All labs are normal. The diagnosis is conversion disorder, psychosomatic blindness triggered by anxiety related to her father's military deployment. He paced across the front of the room like a prosecutor building a case. And yet, Whitfield continued, turning to face the residents with a smile that didn't reach his eyes, "One of our nursing staff has decided that she knows better than the specialists. She's been conducting her own bedside vigil. All night. Every night. Whispering to the child. Running her own theories." A few residents smirked. Someone coughed into their hand. Whitfield turned a page in the chart. "This nurse has convinced herself that the child needs additional testing. Unnecessary testing. Testing that wastes hospital resources and keeps a frightened 8-year-old awake at night with false hope." He lowered the chart and looked directly at his residents. "This is what happens when we let sentimentality override protocol. When we allow maternal delusion to masquerade as medical care." The room went silent. 3 residents exchanged glances. One actually laughed, a small sound that died immediately in the weighted air. Megan's jaw tightened. Not visibly. Just a slight compression of muscle at the corner of her mouth. Her hands continued moving. For kits. Alcohol pads. Saline flushes. Each one placed with the same deliberate care as a surgeon laying out instruments before surgery. Her breathing didn't change. Her eyes didn't lift from the work in front of her. Whitfield wasn't finished. He never was. "The nurse in question bypassed my direct orders and ran additional tests without authorization," he said, addressing the room but watching the back of the space where Megan worked. "A transcranial Doppler ultrasound. EEG monitoring. Additional MRI sequences. All of it unnecessary. All of it expensive. All of it driven by ego masquerading as compassion." He turned another page with deliberate slowness. "I'm documenting her insubordination for the board," Whitfield announced. "And I want to be clear to all of you, and to anyone listening to this recording that will be part of the official record, that when you prioritize your own instincts over established medical protocol, you endanger patients. You waste resources. You undermine the authority structure that keeps this hospital functioning. He looked up one final time, his gaze sweeping across the residence before settling somewhere near the back of the room where Megan stood like a piece of hospital furniture. The nurse will be spoken to, he said. And if the pattern of insubordination continues, there will be consequences. The residents began packing up their materials. Some whispered to each other. Whitfield moved toward the door, already on his next task, his attention already somewhere else. The humiliation had been delivered. The message sent. He had won this round, and he knew it. Megan finished restocking the forecart. She didn't rush. She didn't tremble. She didn't close her eyes or take a deep breath. She simply finished the task, the last kit placed with the same precision as the first, and then she turned and left the room through a different door, moving like someone who had been trained to disappear. 3 hours later, near the vending machines on the ground floor, Megan was getting her second coffee of the shift. The break room was empty except for shadows and the hum of machines. She inserted her dollar and pressed B7. The coffee clattered down. Footsteps behind her. A distinctive walk. Expensive shoes on linoleum. Just wanted you to know, Whitfield said, appearing beside the vending machines with his chief of staff, Dr. Helena Morrison, a woman in her 60s with the tired eyes of someone who had already made all her compromises with the system. I've called in a few favors. 3 board members owe me from various matters. I'm requesting a formal background investigation into your credentials. Megan didn't turn around. She retrieved her coffee. The cup was hot enough that she felt the heat through the thin paper. There are some irregularities in your personnel file, Whitfield continued, his voice dropping lower now, meant only for her ears. Gaps in employment history. Nothing before 5 years ago. It's strange, don't you think? A nurse in her mid-40s with no prior work history. No military service records despite your age. One wonders what you're hiding. He paused, waiting for a reaction. For fear. For the satisfaction of watching her face crumble under scrutiny. Megan turned slightly. Just enough to acknowledge he'd spoken. Then she took a sip of coffee and looked away again, her expression unchanged. Not cold. Not angry. Simply absent, as if his words were audio from someone else's conversation playing in the background. I'll have security escort you out by week's end, Whitfield said, and now there was frustration in his voice, the micro-expression of a man unused to not breaking the things he targeted. If you continue playing doctor, if you run one more unauthorized test, if you defy me one more time, you're finished here. And I have enough connections to make sure you're finished anywhere else you might try to hide. He said it to her back, because she had already turned away from him, already dismissed him from her attention, already returned to the simple act of drinking her coffee as if he were background noise. Dr. Morrison made a small sound, somewhere between sympathy and discomfort. She knew what she was witnessing. She knew what Whitfield was doing. And she was choosing to let it happen, which was its own kind of betrayal, the kind that happened in quiet moments in break rooms and parking garages, the kind that didn't require active participation, only the absence of objection. Megan finished her coffee. She disposed of the cup in the trash. She walked back upstairs to the pediatric ward where Emma Garrett lay in a room that had become the center of her world for the past week, the blind 8-year-old daughter of a 4-star general whose life was hidden behind closed eyes and a diagnosis that didn't fit, no matter how many specialists insisted it did. She didn't know that Whitfield had already made calls. That he had activated a network of favors owed and connections leveraged. That somewhere in the building, paperwork was being prepared. That the clock was moving, irreversible now, toward the moment when everything would come apart. She only knew that Emma needed her. And that tomorrow was 2:22 a.m., when the child would wake screaming from a nightmare she couldn't see, and Megan would be there with her hand on the small girl's shoulder, steady and present, while the hospital slept around them and the machines beeped their mechanical rhythm into the darkness. She had made a promise. It was a promise made to a dead man. And she would keep it even if it cost her everything. The monitor's alarm cut through the silence like a blade through silk. 2:17 in the morning. Emma's oxygen saturation dropping. 78. 75. The numbers falling faster than they should. Megan was moving before the call button lit up. She had already been at Emma's bedside, had promised herself she would be, her chair positioned at an angle where she could see the girl's chest rise and fall without being obvious about it. The machine didn't lie. Something had shifted. Something had collapsed inside that small body. The on-call resident, Dr. Patterson, arrived first. Young. Competent on paperwork. Useless in a crisis. He stared at the monitor strip like it was written in a language he'd never learned, his mouth opening and closing without sound. Around him, nurses moved with practiced efficiency, setting up the crash cart, checking the defibrillator pads, running full lines, but Patterson stood frozen, his hands trembling at his sides. Emma's breathing was shallow now. Rapid. The kind of breathing that meant the body was drowning in its own fluid. Megan had seen this constellation before. Chest pain 3 hours ago, Emma had complained of pressure, nothing the specialists would have documented. Decreased breath sounds on the right side. Elevated jugular venous pressure. Blood pooling where it shouldn't be. And now the collapse of everything. Cardiac tamponade. The fluid around Emma's heart had compressed it like a fist slowly closing. The specialists had ruled it out. Impossible, they said. Too rare for an 8-year-old. Too complicated. Too much like actually thinking instead of reading a chart. Megan stepped forward. Her voice dropped an octave. Cardiac tamponade. Fluid around the heart compressing the chambers. Patterson blinked at her. That's not, the echo was clear. There was no. O2 is 72 and falling. We need a pericardiocentesis. Now. It wasn't a request. The words came out in the tone she hadn't used in 5 years, the voice of someone who had made split-second decisions while rounds of ammunition sparked off desert rock, who had told sergeants twice her age where to move and how fast. The voice of a Master Chief Petty Officer calling tactical. The resident's eyes widened. Other nurses exchanged glances. Megan was already moving. Muscle memory took over, the exact same way it had in Helmand Province when an IED shredded the leg of her squad leader and she'd had to pack the wound and stanch the bleeding while their position was still hot. Her hands found the sterile kit. 18-gauge needle. She'd run the procedure 1,000 times in simulation, but never in the field. Never where it mattered. Never where a child's life meant something personal. She positioned the needle at the 5th intercostal space, mid-axillary line. Landmark anatomy. Clean approach. Emma's small ribs rose and fell beneath her palm as Megan anchored the site with her other hand. No trembling. No hesitation. This was information. Pain was data. The girl's heartbeat was a signal, a message in Morse code that said help me, help me, help me. The needle advanced. 2 centimeters. 3. She felt the slight resistance as the needle penetrated the pericardium, that thin membrane that should protect the heart but had become a prison. And then the release. The fluid came back on the syringe in a dark rush. Pressure relief. Physical, measurable, quantifiable. The kind of problem that had a concrete solution if you knew what you were looking for. Megan withdrew 20 milliliters. 30. The monitors began to shift. O2 sat 75. Then 78. 82. Her hands moved with the terrifying fluid precision of someone who had performed triage in conditions that would have broken lesser people. Steady. Clinical. Focused. The numbers climbed like a ladder out of a well. 88. 90. 92. Stable. Emma's eyes fluttered open. Her breathing changed, deeper now, less frantic. The desperate gasping became something closer to normal respiration. Patterson stood watching. His mouth was still slightly open. Around them, the crash team had gone quiet. No one moved. Someone had seen her hands, the calluses on her palms that no bedside nurse should have had. Someone had heard the terminology slip out. Not "we should think about cardiac tamponade." Not the tentative language of uncertainty. Triage protocol. Evac priority. The exact vocabulary of someone who had run field operations. One of the nurses, Teresa, who had worked 3 shifts with her, made eye contact. The question was already forming behind her eyes. "Who the hell are you?" Megan didn't answer. She checked the fluid collection. Noted the output. Documented the procedure with the clinical precision of someone filing a combat report. Vital stable. Heart rate down from 118 to 94. Blood pressure climbing back to normal. The compressed chambers had room to beat again. By 4:30 in the morning, Emma was resting. Her color had returned. The pressure around her heart released like a held breath finally set free. Megan changed the 4 bag, checked the dressing at the needle insertion site, and positioned the monitoring wires so they wouldn't tangle. Small, careful movements. Nurse work. By sunrise, the machine showed Emma's heart function returning to baseline. The rhythm was clean. Sinus. Normal. The kind of normal that meant a life had been saved by someone who recognized the problem that everyone else had missed. But that wasn't the worst part. By 6:11 a.m., Whitfield had made 3 phone calls. Board members. Men who owed him. Men whose sons had married his cousins, whose country club memberships he'd sponsored, whose medical school loans he'd quietly forgiven through channels that left no paper trail. He spoke in the calm voice of someone activating a network built over 15 years, a network that moved with the efficiency of a Swiss watch. Seattle General's Chief of Staff took his call at 7:13 a.m. By 7:38 a.m., Whitfield had filed a formal request with the Georgia State Board of Nursing, citing protocol violations and unauthorized procedures performed without attending supervision. He attached Emma's chart with a handwritten note, recommend investigation into practitioner's judgment and competency. The background check came back by noon. It landed on the Chief of Staff's desk in a manila folder marked urgent, and Whitfield was waiting when she opened it. Her face changed as she turned the pages. No employment history before 5 years ago. No prior medical facilities listed. No references that checked out. A nurse with a clean record, too clean, like someone had walked into existence in 2019 with credentials already in hand and nothing behind them. Whitfield leaned back in his chair, smile widening like a predator that had caught the scent of blood. Concerning irregularities, he said quietly, "I'd hate to think we've been employing someone with falsified credentials. We have liability to consider." By 2:22 p.m., security was at her locker. Megan stood with her hands at her sides as the guard, a thick-shouldered man named Rodriguez who'd always nodded politely in the break room, emptied her things into a cardboard box. Her stethoscope. The photo of a younger woman in marine dress blues that she kept tucked in the back. Her spare scrubs. The small bottle of hand lotion she kept in the pocket. Rodriguez wouldn't meet her eyes. "I'm sorry," he said. "Doctor's orders. Your credentials are suspended pending review. You're not to access patient areas effective immediately." Whitfield appeared in the hallway as the box was being sealed, his white coat immaculate, his smile cold as surgical steel. He carried a folder thick with documentation, incident reports, witness statements, the formal board complaint, the background check results. He held it up like a trophy. "Ms. O'Brien, I want to thank you for bringing this situation to light. We take patient safety very seriously." His voice carried down the corridor like a blade sliding into place. "Security will escort you to your vehicle. Your suspension takes effect now. When the board completes their investigation, we'll discuss whether reinstatement is even possible." He said it the way someone might discuss the weather, casual, inevitable, final. Megan took the cardboard box. Didn't speak. Her jaw tightened, one barely perceptible movement, but her hands remained perfectly steady as she accepted the weight of it. She walked toward the employee exit without looking back, Rodriguez following at a respectful distance, the kind of distance men keep when walking behind something dangerous that has decided not to be dangerous. The smell of antiseptic clung to her scrubs. The fluorescent lights overhead buzzed their endless mechanical hum. By the time she reached the parking garage on level 2, the sun was bleeding orange across the Atlanta skyline, and she was officially nobody. The Honda was 11 years old, the kind of car that didn't draw attention, the kind of car that belonged to someone with no money and no future. She sat behind the steering wheel with the box on the passenger seat, keys in her lap, and she couldn't make her hands turn the ignition. The engine was dead, had been dead for 2 months, and she'd been paying the parking garage rent on a vehicle she couldn't drive, keeping it like some talisman against the moment she'd have to run. The rain started around 3:51 p.m., soft at first, then hard enough that drops hammered the windshield like someone was demanding entry. Her forehead rested against the wheel. The horn didn't sound, dead battery, dead car, dead everything. Rain slicked down the windows. The parking garage smelled like motor oil and wet concrete, that particular metallic tang of enclosed spaces. She could hear a siren somewhere out in the city, getting closer, then fading. Getting closer, then fading. The rhythm of emergency response, of people going somewhere, of having a purpose and a place to be. Megan reached into her scrub pocket and pulled out the coin. Tarnished military challenge coin, the kind given to soldiers who'd done things that couldn't be written down, things that lived in classified files in Pentagon basements. She'd carried it for 5 years, the coin from the last operation, the one that went wrong in ways that couldn't be fixed. Her thumb traced the raised insignia, edges worn smooth by constant contact. Helmand Province, 2019. 23 soldiers brought home because she'd held a tourniquet and called for fire and moved faster than fear. Her son's commanding officer among them. And then the order came, disappear. The Navy erased Master Chief Petty Officer Megan O'Brien from the database. Her records, buried. Her service, classified. Her name, dead. She opened the window and held the coin over the rain. For a moment, just a moment, she almost released it. Let it fall into the garage concrete. Start over as someone else. Someone with a normal name and a normal past and a normal future that didn't involve watching through chain-link fences while the men she'd trained with got medals she could never receive. The rain hit her hand like cold judgment. The coin caught the light from the parking garage lamp above, reflected it back at her like an accusation. And then she heard it. Distant. Rhythmic. Growing louder. The sound of helicopter rotors cutting through the Atlanta evening, that distinctive thudding percussion that makes the air itself change pressure. Not an ambulance. Not a news chopper. Not the kind of aircraft that flies routine patrols. The sound was moving toward Seattle General. The sound was moving toward her. Megan pulled her hand back inside the car. She closed her fist around the coin. Through the rain-streaked windshield, she could see movement at the hospital entrance 8 blocks away, lights turning, vehicles arriving. The helicopter sound swelled, then shifted direction. Multiple aircraft. Not one. Several. She didn't know what was about to happen. But soldiers know the difference between the end of something and the beginning of something else. And this was a beginning. 3 days later, the ER doors burst open like a spring-loaded trap. Gunshot wound to the left thorax, BP dropping, the medic calling out vitals in clipped military cadence. Megan was restocking the crash cart when the patient locked eyes with her from the stretcher. His face went white. The color drained like someone had pulled a plug. He was older now, scarred across one side of his jaw, but she recognized him instantly. Taliban fighter turned informant. She'd pulled him out of a collapsed compound in Sanjan Valley 13 years ago. He'd been bleeding out. She'd used her bare hands to apply direct pressure to a femoral bleed while rounds came through the roof. He whispered something in Pashto. One word. The code name that was supposed to be buried with the operation. Valkyrie. The word hung in the fluorescent hum of the ER like a bell that would never stop ringing. Megan's hands did not shake. Her face did not change. She turned back to the crash cart and continued counting sutures. The ER team moved around the patient in organized chaos: 2 trauma surgeons, 3 nurses, a respiratory tech. Nobody else had heard. Nobody else understood what that single word meant. But the security guard at the entrance had. Former Army Ranger. His spine straightened like someone had flipped a switch inside his chest. His voice carried through the corridor with the precision of a drill sergeant calling cadence. Master Chief Petty Officer on deck. Not a question. A statement. An announcement. The words landed in that ER like a name being read at Arlington. The room did not stop moving. It could not. The patient was still crashing. But something had shifted in the air itself. The medical staff exchanged glances. Who was this nurse they'd been dismissing for 3 weeks? General Marcus Garrett arrived within 54 minutes. Not called. Appeared. The hospital administrator walking beside him looked like he'd swallowed a stone. The 4-star came straight to the boardroom where Dr. Whitfield was reviewing billing reports, utterly unaware that the ground beneath his career was about to collapse. Whitfield stood when the general entered. He did not stand quickly enough. General Garrett held a classified file folder open. His voice was level, the kind of calm that comes from commanding men in situations where wrong decisions meant body bags. He began reading. Not discussing. Reading. Like the information was being entered into an official record that would exist long after everyone in the room had turned to dust. Master Chief Petty Officer Megan O'Brien. Service record spanning 23 years and 7 months. 3 Bronze Stars for Valor under fire. He paused. Let that sink in. Silver Star for leadership under extreme duress in Helm and Province, 2011. Another pause. Whitfield's face had taken on the texture of old parchment. Navy Cross for actions on September 14, 2013, when she led an extraction of 23 soldiers from a compound that was being systematically reduced by enemy fire. 2 Purple Hearts. Surgeon-level combat medical training. Certified trauma surgeon, certification earned in a forward operating base with no running water and Taliban mortars incoming. Her performance record in active duty was marked exemplary for 8 consecutive years. The board chair was taking notes. Whitfield was looking for the door, but the general was still speaking. The reason you have gaps in her civilian employment history is that she does not exist on civilian records. She was ordered to disappear. Official erasure. The Pentagon does not acknowledge her. She does not have a security clearance anymore because officially she was never cleared. She was never here. That was the deal when her last operation did not go according to specification. She took her discharge papers and a new name, and she was supposed to vanish into nursing because nursing is where people go when they want to save lives quietly. Emma Garrett was sitting in the corner of the boardroom. Her vision had improved 87% in the past 6 days. She stood up with the kind of determination only an 8-year-old could muster. That nurse showed me the coin, Emma said. Her voice was steady. Young but steady. The tarnished one. She keeps it in her scrub pocket. She told me it was from the mission where she saved 23 soldiers. She told me the medic who gave her the coin wrote me letters before he got sick. He was her friend. He was my daddy's friend. And the nurse carried that coin every single day so she would remember that he was brave and that I should be brave too. The silence lasted exactly 10 seconds. The room went so quiet you could hear the fluorescent lights humming their electric drone. Dr. Whitfield moved toward the door. The general did not block him. Did not need to. Whitfield had already seen himself in the room's reflection. Already understood the mathematics of what was about to unfold. By that evening, the video was circulating. Not through hospital channels. Through the internet. Someone had recorded the grand rounds. Someone had captured every word he'd said about maternal delusion and playing doctor. Whitfield's own medical school mentor saw it at 11:24 p.m. while scrolling through social media. 31 years since graduation. 31 years of mentorship and recommendation letters and phone calls vouching for the young surgeon's character. Dr. Harold Ashford, chief of surgery at Johns Hopkins, picked up the phone and called the hospital administrator. "I do not know who that man is anymore," he said. "But he is not my student. Not my responsibility. Remove his name from my department's roster. I am sorry I ever trained him." The ethics review was initiated at midnight. By 6:33 a.m., Dr. Whitfield's hospital privileges had been suspended pending investigation. But Whitfield was not finished. Not even close. At 7:19 a.m., he arrived at the hospital with a federal investigator he'd apparently contacted overnight, some former colleague in a position he'd overstated significantly. He had Megan pulled from patient rounds. He was screaming before they even got to the private office. Actually screaming. His voice had a quality of a man whose world was collapsing in real time and who could not accept the collapse. He was accusing her of fraud, of military impersonation, of infiltrating the hospital under false pretenses. The investigator, a man who looked increasingly uncomfortable, was trying to establish credibility by looking stern. "You have no authority here," Megan said. Her voice was so quiet the investigator had to lean forward. "I have a current nursing license. I am credentialed by this hospital. And you, Dr. Whitfield, are currently under ethics review and have no standing to conduct any investigation. You are also currently screaming at a federal investigator, which I suspect is not helping your situation." Whitfield swung. Just completely lost control and swung at her. A closed fist aimed at her face. His arm had traveled maybe 6 inches when the hospital security guard, the ranger, caught his wrist and held it with a kind of grip that translated to surrender or broken bones. "Choose now." Whitfield chose surrender. He collapsed into a chair, still screaming. Still insisting that she was not who she claimed to be, that the Pentagon records were fabricated, that this was all some kind of conspiracy. The investigator was already signaling for local police. This had stopped being about medical credentials somewhere around the moment a doctor attempted to assault a nurse in front of a federal investigator. 6 months later, Megan walked through the parking lot of a strip mall in northwest Atlanta. The afternoon heat was thick as a blanket. She was heading to her next shift, director of emergency medicine now, restructuring trauma protocols, integrating unconventional diagnostic approaches, building a program that trusted its nurses, when she saw the folding table. Whitfield Insurance. That was the banner. Hand-painted, tilted slightly because one of the legs was shorter than the others. Whitfield was sitting beneath it in a plastic chair that looked like it was one good wind away from collapsing. He was wearing a polo shirt with the company logo stitched on the chest. His name tag read, Steve. He looked like a man who had aged 10 years in half that time. Megan approached the table. Whitfield's face went through a series of reactions: recognition, shame, defiance, resignation, all in about 2 seconds. He tried to straighten. Tried to regain some authority. She reached into her scrub pocket. Found the tarnished challenge coin. The one she'd carried through 3 wars and 2 continents. The one with the names of 23 soldiers scratched into the back, including the medic who'd written Emma letters, who'd believed in things like honor and courage and the sacred weight of keeping your promises to people you would never see again. Megan placed the coin on his clipboard. Not gently. Not harshly. Just placed it. A gesture that meant everything and nothing simultaneously. She continued past the folding table. Did not look back. By 11 p.m., she was back at Seattle General. Emma Garrett was in the waiting room for a follow-up vision appointment. 90% recovery. The girl ran to her. Megan knelt down and let Emma hug her without crying, without trembling, without any visible response except for the gentle pressure of hands that had held her through darkness. "Your vision test came back," Megan said. "The results are in my pocket." "Will I see everything now?" Emma asked. "Everything that matters," Megan said. "You already do." The trembling was not fear. It was restraint. The discipline to not celebrate your own survival when there were still soldiers coming home with wounds nobody had names for yet. The strength to stay quiet about the things you'd done so that other people could sleep soundly in their homes. The ones who had seen the worst often give the most. That is the story of a nurse who would never be called a nurse again by anyone who truly knew her name. And how sometimes the most powerful people in a room are the ones everyone mistook for ordinary. Like this video if you want more stories about people who quietly change the world. Subscribe if you want to know what happens when the hidden finally become seen. And comment, have you ever been completely underestimated by someone who had no idea what you were capable of? What would you do in their position?